Drug or medicine? Today we will be discussing why everyone calls ayahuasca a medicine. Is that a fair terminology for it, or is it just a new age and fashionable way of getting high? Let's get right into it. My name is Ivan. I've been a facilitator of ceremony for over 10 years, and the topic of today's discussion shows up very often with people who have never heard about ayahuasca or who have heard about it, but they don't want to experience it because they don't do drugs. By the way, that was me. Now, to be able to discuss this topic properly, we first need to define these two words, but not in the same way in which the dictionary defines them, but more about what are the concepts that show up within ourselves when we talk about medicine or drug. Let's first start with drug. When I say the word drug, what are the first concepts or ideas that show up for you? For most people, those are, it is bad for you, it is addictive, you are escaping your problems, maybe it's neurotoxic, enjoy first and pay for it later, maybe you are lost in life and that's why you do it, or it is more a party thing. Maybe they need to do it again. All of these are the things that show up when we think about drugs. And there is one more that I left out on purpose, but we will talk about that in a minute. Now let's talk about medicine. When I say the word medicine, what shows up within you? You can pause the video if you want to take a second to think about it. All right, so the things that usually show up for most people are they're good for you, they are healing, they are not addictive, is not the point. They are not meant to party. Who takes a medicine to have fun or to party? It takes care of your health issues. They are not bad for your neurons. They are not neurotoxic. And there is no need to do it again, right? If you take something that it is meant to heal you and then you heal, what would be the point of taking it again? If I take a medicine, I should not only feel better, but I should also be better. Now, why am I talking about this? When you take drugs in the way in which we think about them, we also feel better, but it is temporarily. We feel better first, and as I said, we pay for it later. Now, maybe you recall that I left one specific element of the idea of drugs out of my list, and I did it on purpose, and maybe you already know what that one is. Drum roll. Yes, drugs are psychoactive. They get you high. So, why is this important? Here is where most of the confusion comes. If drugs are psychoactive, and they are also all of these other things that we talked about, bad for you, addictive, escape your problems, enjoy first, pay for it later, neurotoxic, what happens is that we associate the fact that they are psychoactive with all of these bad things. We are really scared of all of these bad things, right? When growing up, our parents, our society tells us, be careful with drugs. If you do drugs, you're going to lose your life, you're going to go down the rabbit hole, you're going to get addictive, and drugs get you high. And so we have associated these two concepts. They're almost like the same thing. If something is psychoactive, then it is all of these other things too. At least that's how I grew up, and the mentality that I had, and what I was being taught by my parents. Maybe you relate, maybe it was somewhat similar for you. On the other hand, if something is not psychoactive, therefore is not a drug, right? Because we have this idea that we take drugs because of the psychoactive effect and to have fun. So why would anyone take drugs that are not psychoactive? So now I would like you to take a minute to think about the following idea. Let's imagine something is not psychoactive, but it is all of these other things that we associate negatively with drugs. So it is not psychoactive, but it is addictive, it is bad for your neurons, it is really hard to get off of, you do it to escape your problems, even though it might sound strange. How could I be escaping my problems if it's not psychoactive? But let's imagine, at least hypothetically for now, that this is true for some substances. Not psychoactive, but it's all of these other things about drugs. Would you then call it a drug? And should you be very careful with these substances in the same way in which we have been taught to be careful with drugs? Now let's think about the opposite scenario where you have a psychoactive substance, but it contains all of the elements of medicines. So they're good for you, it is good for your neurons, you don't do it to party because medicines, we talked about that, we don't do them to party. They take care of your addictions, it is not addictive by itself, and it ultimately takes care of your health issues so that you don't need to do it again. In this scenario, would you consider this substance a medicine or would you consider it a drug? If you're thinking, well, it is psychoactive, therefore it is a drug, doesn't matter if it heals you, if it's good for you, if you're better after the experience rather than worse, if your neurons are better, if your health is better, it doesn't matter. Because it is psychoactive, then it's a drug. Then that's okay. But let's acknowledge that we're associating drug with psychoactive, psychoactive with bad, and bad with all of the negative health effects. Because if we would have started our journey about the idea of drugs with the idea that psychoactive things are good for you and are good for your health, we probably wouldn't really mind to call something a drug. So is it fair to at least ask the question if maybe we already have a concept of what drugs are and that it is really hard for us to detach from this concept that we have been hearing since we're kids? Now let's approach it with a different perspective. Imagine that you take a substance, it doesn't have a name, it doesn't matter psychoactive or not, you just take a substance and by the end of the effects of this substance, you are better. Not only you feel better, but you are better. Your health is better. Your mindset is better. Maybe an infection is gone. Maybe your back pain is gone. Maybe you were depressed and you are not depressed anymore for good. If that were the case, without knowing what happened in the middle, would you call that a medicine? I personally would. Why? Because I took something and I was healed afterwards. And now I don't have to deal with that problem anymore. I hope that you can see where I'm going. It doesn't matter whether something is psychoactive or not. The fact that something is psychoactive should not be the bar in which we measure if something is a drug or it is a medicine. To me, it is more about, does it heal you? Is it good for you? Or is it bad for you and it does the opposite of healing you? Does it harm you? Well, there are plenty of medications that we find in the pharmacy that have all of the negative effects that we mentioned about drugs without being psychoactive. Now, I'm going to mention one substance, but it is not limited to this one example, and that is antidepressants. Antidepressants are addictive. It's very, very hard to get off of them. They help you escape your problems. This means that your depression is not really gone. You just don't feel it while you are taking the antidepressants. How do I know that? Well, when people stop taking their antidepressants, they fall back into depression. They help you escape your problems. Again, you are not really addressing the source of your depression. It's just making you feel better, even though if you have to pay for it later. Yes, it is a little bit different in terms of comparing it to a party drug. However, it is not that different. You take the antidepressant and you feel better. However, the day that you stop taking them, not only you will fall back into your depression, most people fall into an even worse depression. And then we also have the issue of the negative impact that these antidepressants have in the chemistry of your brain. This is by itself a much longer topic, so if you'd like to hear more about it, I recorded a video that you can check right here. Now, we mentioned a lot of these elements that make us think of certain substance as a drug. Bad for you, escape your problems, addictive, hard to get off of, enjoy first, pay for it later. And even though this one is not psychoactive, it still falls under that category of you have to be very careful with this substance. And I didn't even mention the array of side effects like sexual dysfunction, gaining weight, having trouble sleeping, and specifically one more, which is preventing you from actually dealing with the problem. If I take antidepressants, then I will not be able to really take a deep look at the reason why I was depressed to start with. I hope this helps you start detaching a little bit from the idea that psychedelic means drug and that non-psychedelic means medicine. All right, let's debunk now the other side of the coin through ayahuasca. So ayahuasca is psychoactive. However, is it addictive? Well, no. Anybody who has taken ayahuasca will tell you that it is not an addictive substance. You take it And the first things that you go through are pretty uncomfortable, unpleasant. Actually, people who do ayahuasca sometimes take months or years to decide to do it again, even though they experienced a lot of benefits from it. So that is kind of the opposite of addictive, where you just can't help but want to do it again, and you have to try to prevent yourself from doing it. Okay, myth number 2. Because it's psychoactive, therefore it's a drug, and therefore it is meant or used to party. Do I really need to say that this is not the case? Can you imagine drinking ayahuasca in a party and then you go dancing while you're puking? Anyway, I think that is pretty clear. Nobody does ayahuasca to have fun or to party. They do it to get the benefits that you get from drinking this medicine. Myth number 3. We take it to have fun first and pay for it later. I think I already debunked that one. You go first through a challenging experience and then you get the benefits later. So rather than enjoy first, pay for it later, kind of like a credit card, you pay for it first and then enjoy the benefits for the rest of your life. Kind of like buying something in cash. I think this is a really good analogy because what a relief to just buy something and forget about it and then experience the benefits of that thing that you bought. Now, in this case, what you bought, it is your own well-being, and the way in which you paid for it wasn't with cash, but you acquired it with your work and the effort that you put during the experience. Myth number 4, it is neurotoxic, bad for your brain. Also not the case. Plenty of research out there, you are more than welcome to look it up, but what ayahuasca does, among many things, is the potential for neurogenesis. Neuro comes from neurons, genesis is from generation, so it means that generates neurons or generates new neural connections or neural pathways. So when you take ayahuasca, your brain becomes more plastic from plasticity. So it means that now your brain has a better capacity to absorb information, to create new neural pathways that are ultimately beneficial for you. So it has been shown over and over again that people who drink ayahuasca have better overall health, have a better psychological and mental health. They have less violence at home. They have less anger, less emotions that are trapped that then burst out in different life situations. Here are a few other, if you want to call it, good side effects of ayahuasca. It is antiviral, antifungal, and antibacterial. So for example, if you're about to get sick and you drink a few drops of it, it will actually help you fight the infection. I have a friend who gets sick every single year like a clock. Every time that he feels that his throat is starting to ache, 100% of those times he gets sick the day after or 2 days after. And one day he was about to get sick, like he always does, and I said, why don't you drink a few drops of this first and see how bad this gets? It was very little, not even enough to have an experience, and he didn't get sick that time. So it is pretty amazing what it can do for your body. Imagine now that you're actually drinking this, and these properties, these antiviral and antibacterial properties, are now within all of your body. So it is really good also as a way to help your immune system fight any invaders. One more cool thing about it that helps it differentiate from normal drugs, and that puts it more in the category of medicine. I have seen plenty of times people who would do every drug that it is available on earth. You know, if you name it, they've done it, and they want it, and they want it now. And when you mention ayahuasca, they're like, no, that's not for me. And on the other side, people who have never done drugs, who would never do drugs, people who have religious beliefs, or they are really afraid of doing drugs because they are bad for you, that they end up deciding to do a ceremony, and ayahuasca becomes their first psychoactive and also their first healing experience. And I find that to be pretty interesting, that so many people who would do every drug on earth wouldn't do it, and so many people who wouldn't do drugs decide to do ayahuasca. So clearly this substance, it is separated from all of the other ones. We are afraid of drugs because we are afraid ultimately to harm ourselves. If ayahuasca is done in the proper setting with a careful and diligent facilitator, without combining it with certain specific pharmaceuticals, for example SSRIs, and in the proper dosing, then it is practically impossible to harm yourself with this medicine. So then you can argue, fine, Ivan, then with the improper dosing, I can definitely hurt myself with this medicine. Well, yes, that is true. This is why I'm talking about it. But that is actually true for literally every substance, psychedelic or non-psychedelic, even with water. Water is a source of life. You need it every day. You need it several times a day. But if you dose yourself with water improperly, if you take, I think it's something between 6 or 8 liters in 1 hour, you actually can die. So like with any substance, with food, and with any medicine, you need to dose it properly. Overall, I can totally understand why thinking of a psychoactive substance as a medicine can be very hard for most people. That idea has been taught to us by people who have been approaching psychedelics from the wrong place, stemming specifically from the war on drugs that started with Nixon a long time ago, that it has been proven over and over again, not only to have failed, but also that it started from the wrong place and with the wrong intentions. So I believe that we should ask ourselves, can I let go of my preconception about psychedelic substances and actually look at the data? Because if we do, we will just see that there is plenty of research that supports the healing properties of this beautiful medicine. Alright everybody, hopefully this helped clear out any doubts around this topic, and as always, thank you for your attention and for your interest in healing. Before you leave, please don't forget to like, subscribe and hit the notification bell, because I just started this channel and in these initial stages, that helps out a lot. And I'll see you in next week's video. Click on the left square to watch another video I made on a related topic. All my content is free. If you appreciate it and wish to assist me to continue releasing this kind of content, please consider supporting me on Patreon. You can also follow me on my socials and subscribe to this channel.